doing my best to contribute to the improvement of the lot of humanity is always one of the goals of my life. But it's not always that one gets a chance to meet and speak with like-minded people. Today is one of those times when I was fortunate enough to speak with someone who does exactly that with her career. In this wide-ranging interview with Dr. Omo Emeagui of Nigeria, we get an opportunity to discuss the joys and the challenges and the various aspects of Nigeria's healthcare system. It is just the first part of a series of 2 interviews that I did with her. Please watch. It is always my pleasure to welcome guests to my show to have discussions about things going on around our world. My name is Ohiro Oni-Eseleh, and today it is really my distinct pleasure and honor to welcome Dr. Omo Emeagui, who is based in Nigeria, works at the Federal Medical Center in Delta State in the Department of Pediatrics. And she is soon going to be a specialist with interest in behavioral pediatrics. Today, I'm going to be asking Dr. Miyagi a bunch of questions because I really like to know about the healthcare system in Nigeria. And one of the things that we know is that people who practice medicine in Nigeria very often know about medical practice and healthcare systems in different parts of the world. So we are also probably going to touch on some things about the healthcare system in other parts of the world. So, Dr. Miyagi, I know that you're at work right now, and for us here in the United States, it is still early in the morning, but you have already put some hours into work. So so I like to welcome you to this show, and I hope that we are going to have a very substantive conversation.
Thank you. I'm happy to be here.
So, what time is it in Nigeria?
It's probably 12:30.
it's still early here, but again, I thank you for coming. And so I am just interested in knowing why your interest is in pediatrics.
Well, growing up, I always wanted to be a doctor. And my mom is a nurse who has also contributed her quota to the healthcare sector in the country. And I think that challenge or spurred me. But I wanted to do something more, just beyond nursing the patient. But
is that your mom?
That's my mom. that picture was taken when my last sister did her introduction sometime 2 years ago.
Well, just let people know that in Nigeria, introduction means something. It's not you just meet someone else and you say, my name is this and your name is that. In Nigeria, introduction means something different.
Yeah, introduction ceremony means a pre-marital ceremony where both families, the family of the husband and the wife, get to meet themselves formally for the first time, and then exchange contacts, exchange phone numbers, get details about themselves just before the ceremony. The wedding ceremony takes place. It can be months before the wedding ceremony finally holds, but it's a formal opportunity for both families to get to meet themselves. So that was 20 years ago.
Yeah, because in Nigeria, you just don't marry someone, you marry a family, basically. You marry into a family, right?
Exactly.
So you were telling us that you chose to become a doctor.
Because I wanted to help out, to contribute to the healthcare of patients. And that motivation came from having a mother who was already in the health sector, who was already helping out patients. And that spurred me. I wanted to do something more, not just nursing. I wanted to do something more. That motivation was what encouraged me to do medicine. Although initially my first choice was to do physiotherapy, but somehow my father felt that medicine was my calling, and he sort of encouraged me, advised me, also, supported me academically, because at that time I was battling with one of the basic sciences, I think physics. And my dad was quite good at mathematics and calculations, so he supported me. He always went through my school notes and then made physics easier for me to cope with.
Your father is an engineer, isn't he?
Yes, he's an engineer. He's an electrical engineer. And he prides himself in it, actually, because he worked so hard to get there. And he's actually registered with the Koren. I think Koren means Organization of Registered Engineers of Nigeria or something. So, and he has worked so hard to achieve the status he currently enjoys. And he is also one of my biggest fans.
Fan. Yeah, let me tell you why I am actually holding myself back from busting into laughter. It is because I know where your parents are from. I know your hometown. And it so happens, and I think you probably know this, it so happens that that's also my native land. It's also my hometown. So that when you said that you chose to become a doctor, I was actually laughing, and because for those of us who come from that part of the country, choices like that are usually not left up to children. We want to have a child who is very educated. Very often we want a child, so we gently guide you in the direction of becoming something really important. We guide you gently.
Gently guide you.
Yes. We are not going to force you. We'll just guide you gently towards success. And it's almost as if every educated or a man or woman also wants to have like one doctor, one engineer, one lawyer. Yeah, and your sister is an engineer, right?
Yes, my sister is an engineer. And I think also, one of the top best. I mean, one of the best in her class.
Right.
Her graduating class, yes.
And I'm sure that she was also gently guided by your parents.
Well, she actually wanted to do medicine,
right?
But I discouraged her. I was like, you like calculation, you like to solve physics, and that's something you're passionate about. So why not do something related to that? And that was how she changed her mind and decided to do engineering. She's a petroleum engineer.
Oh, she is. Right. And you had an aunt who was a physiotherapist many years ago, right?
So I was told.
Yeah.
That's my mother's eldest sister.
That is correct.
So I was told, but I met her. I was very small, very young. I never really got the opportunity to interact with her, but I was told that she was a physiotherapist.
So why did you choose to be in pediatrics? I'd like to go back to that. And in addition to that, I'd like to know why your interest is in behavioral pediatrics.
Okay, maybe I'll just tell a short story. But for pediatrics, child medicine is one area that a lot of people, they seem to run away from. Because there's this idea that as a surgeon or OBGYN, that's the obstetrician, you tend to get worthy remuneration for care of patients. But as a pediatrician, what you definitely get from the parents will be, God will also help your children. Mm-hmm. So a lot of people are wary about pediatrics simply because apart from the benefits that goes with other subspecialty, pediatricians are said to be wonderful people because the child, especially the very young children, can't tell you it's aching in here or the pain is here or the problem is here. So you have to study a lot of signs and symptoms, observe in pediatrics. I took interest in pediatrics because I felt like pediatrics is a challenging area, and then it's one area where you do the magic and you see it. The child doesn't pretend, not like the adults that they are treating and he has recovered, but he still wants to get the attention. So he keeps saying, I don't want to feel too strong. But by the time you treat a child and the child is fully recovered, you see it. You see the child spring up back almost immediately, go about the daily activity as if nothing has happened. So the innocent child that deserves health care, that deserves all the attention from the medical angle, was one of the reasons why I decided to go into pediatrics. And the fact that pediatrics in itself is challenging. Then for developmental pediatrics, or behavioral, because it's developmental behavioral pediatrics, it's my interest. I started taking interest in my first year in residency. I just had my son and he had a delay in speaking and communicating. Several times I'll have to call my mom and say, I don't know what the problem is. We have never noticed or observed things like this. Then I got information that a cousin of mine was also experiencing something similar, that her 3-year-old son at that time wasn't talking, wasn't communicating, was all by himself. So I reached out to her. I wanted to know why. She told me, well, I think it's just a delay. He will pick. But I didn't want to be seen as that doctor who left her child without him getting appropriate therapy. So I reached out to some colleagues who felt, okay, I think it's just a little delay, but if you are so worried, maybe you should first of all start with checking out his hearing. You should see an audiologist to check out his hearing to be sure that he's hearing properly. I just told them that what I discovered is that when you put on the TV and he's in the room, he knows the TV is on the moment the sound from the TV comes out, and he runs out of the room into the room where the TV is. So that means that his hearing is intact. But I still wanted further confirmation. So I went, he did the audiology test, he was fine, there was no problem. And I was a little bit consoled, like, okay, at least his hearing is intact, but he still wasn't talking, and he didn't make any effort to communicate till he was 4. But, he's doing very well now. His IQ is very high. So that spurred me to read about children who had developmental delay, language delay, cognitive delay, poor social interaction because they seem to be in a world of their own. I started reading books about autism, attention deficit hyperactivity disorder, Asperger syndromes, and a lot of them. And well, to cut the long story short, I met a friend of mine who had a set of twins that also had similar delay, but her kids have already been diagnosed as autistic and they were already on the spectrum. A pharmacist, and she was like, okay, Omo, if you have this challenge, you're a doctor, I'm a pharmacist, what do we do to help the children? I was motivated and said, okay, first of all, we have to get therapists. We have to get behavioral therapists, cognitive therapists, speech therapists, language therapists. We have to reach out to them. We have to find out those who are willing, even if you are going to get a fee for service, but you should be available. And it dawned on us that in the entire Delta down to as far as Enugu, we couldn't find those therapists. The few ones we saw, I saw 1 or 2 in Benin. These people were old and getting ready to retire. So On one of those days in my clinic, I confronted my consultant and said, "You're a neurologist, for Christ's sake. You are treating seizure disorder, mental retardation, children with epilepsy, children with neurologic dysfunctions. Have you not ever wondered, these ones that come to your clinic, because, they just put them as part of neurology patients, but they're actually special patients who we benefit from early intervention, which, of course, the advanced world has and Nigeria lacks. Some parts of Nigeria, except if you go to Lagos or Abuja, you won't find those therapists around this down south here." So he said, "Well, Omo, you are saying, am I not a neurologist?" I said, "Yes, sir." He said, "That is not my job. My interest should be, once I discover this problem, where do I send them to?" And that's the truth. Where do you send them to? So somehow, a lot of people knew that I started getting numbers of those you can reach. I contacted a behavioral therapist who I encouraged and convinced to set up a center in Asaba. And he did. He started the center.
Asaba is the capital of Delta State, right?
Of Delta State,
okay.
Yes. And he was convinced. He came in, he set up, he trained a few hands he met on the ground, and he brought in his own therapists to complement those in the city. And they've been doing quite a good job. My son was even seen by one of them at a time, who had it, because behavioral therapy includes having a one-on-one contact with the child, personal teaching of the child, encouraging the child on certain response, rewarding, reward and punitive measures. So, and today I think he's talkative. He talks a lot. If I was at home, probably would have popped in here severally to find out who is mommy talking to. And my mom would just laugh and say, okay, Chuku that they say won't talk. Look at, he talks, he interacts so well. He's doing very well in the school. And he has outgrown that stage. It just dawned on me that, even from research, that early intervention, you pick these children early, 2 years, 18 months, you start the intervention, you follow up, you will see very good results. But the problem, this myths and belief in Africa, the child is not talking, they say it's either a witch, or the child is possessed with some evil spirit, or maybe the family is under attack, spiritual attack. So we ascribe wrong, connotation, no wrong meanings to children like that. At the end of the day, what happens? The child is abandoned. Sometimes he's locked up, further worsening his clinical problems. So the child is locked in because he's having a delay. You worsen that delay by making it a permanent impairment, and furthermore, probably a disability. But if you come out, like the GT Bank is trying to bring the Autism Speaks, you speak out and say, my child, I noticed this child is having this developmental delay, it's not making social contact, it's not interacting, and you come up, you speak up early, then interventions can be made to help that child reverse back to his normal development. So these are many other reasons why I decided to do pediatrics, why I became interested in behavioral pediatrics. And in Asaba now, if you need a speech therapist, you need a language therapist, they'll just tell you, call Dr. Omo Emeagui, she'll contact them for you. I'm excited about this, because I feel that it's an opportunity to give those children the chance to develop normally. No child is completely useless. I once read about Einstein, who didn't speak until he was 6, and that story actually portrayed his mother as the major support for that child. She kept saying, even when the teachers in school were saying nothing is going to come out of him, he's going to be mentally retarded, and she kept saying he's going to develop normally. So if we encourage parents to be responsible for those children, make effort to reach out, provide the supportive service, not just reach out, because the supportive service, the therapists have to be available, train and retrain. Then we give those children the chances of getting the benefits of good quality life. It's all about early intervention.
Right. I will ask you two questions rolled into one, because I have just been listening to everything you've been saying with tremendous interest. Number one, if you did not have the kind of education that you have, you're a medical doctor, that's one. And you did not have the means to be able to look for the resources. And also, if you lived in a rural area and didn't have all of these resources, and the Nigerian healthcare system is the way it is, what might have been the prospects that a child that was in your child's situation would accomplish what Okechukwu has accomplished today?
Wow, that's tough. That's part of the reason why we are advocating for the children with the developmental delays. The chances are very slim, and not just slim, the prognosis is poor, very poor. It takes an educated mother who will not be subdued by society. It also takes political will. The government have to come in, equip the hospitals, provide the skill. It takes a lot of finance because you need to train staff, you need to train people. And finally, it takes, commitment from everyone. Members of society. This idea of saying the child has a demonic spirit being possessed, if we downplay on all those things and look for scientific evidence for the cause of disability, impairments, delays, behavioral problems, we'll find solution. And that's why I say a lot of political will. There has to be interest from the government. There has to be support from the government. There has to be support from the government. There has to be provision for equipment. Like in the case of occupational therapy, you need to provide certain equipment that the occupational therapist will work with while caring for the patient or while supporting the patient. So if those things are lacking, educated mother, yes, but when a mother's family pressure or supposed, relatives around have a contrary opinion, they're likely to suppress the woman's belief, the woman's conviction that her child is not. It takes a really strong woman and bold woman to ensure that the care she desires for her children, they get it. Not just bold, also an economically empowered woman. Because you can say, I want this, but how do you access the facility? How do you get there? Do you have the money to reach out? So in the developed world, they talk about health insurance, community health insurance, national health. But here, national health insurance is restricted to just the federal civil service workers or the state government workers. A mother who is doing a private business or is a farmer like you gave, like the example you gave, she lacks insurance. There's no health insurance coverage for that mother. So is it the daily earnings she gets that she would use to seek out for health care? So if whatever the relatives tell her or people in the family tell her, she's likely to succumb to that, even if she holds a contrary opinion. So it starts from the educated and empowered mother, the political will to ensure that even up to the PHC, basic amenities, basic medical care is provided. And this is through training and retraining of the health workers. The local government is not absolved of any form of blame here, because you see that local government leave everything to the states. That is why the PHCs suffer. The local government chairmen or councillors or whatever they are called make efforts to develop their primary health centers, utilize corpers, that's youth service, youth corpers, utilize young doctors, and even encourage proper remuneration of medical officers. I'm sure people will be willing to go to the PHCs. These days, the PHCs are left unattended to everyone, even those in the village, is coming to the general hospital or going to the tertiary hospital. So the function of the PHC is leaving a huge vacuum. That is the place where counseling occurs, basic preventive services like vaccination is done, is an opportunity for interaction at the grassroots, education, health education. You can counsel them, you can have a one-on-one interaction with members of the community. But because the PHCs are not functional, those services that they provide are almost crumbling. If you go to my village now, I'm sure there's no primary health center there. It's just the building, and it's left for probably the chief or the matron in charge who has been there for many years to handle. And that was not the sole purpose of creating the PHCs.
What you have just seen is the first part of my wide-ranging interview with Dr. Omo Emeagui. The second part will follow.